Welcome to the audiocast, current trends and length of stay for total joint replacement patients. My name is Jason Pry, and I'm a managing senior director at Accelera Health Partners. Joining me is Dawn Demarest. Dawn is a director of the joint replacement program for Accelera and also has her MBA, MSN, and RN. We know that total joint patients continue to spend less and less time in the hospital post-operatively. So today we're going to discuss some of the potential impacts to care and how really a shorter length of stay can still lead to a positive long-term outcome. So Dawn, Medicare continues to shorten the geometric mean length of stay for total joint patients. What are some of the current trends?
Well, what we've seen is those hospitals that have implemented deliberate care processes to reduce length of stay have been able to effectively discharge patients day 2 or less 91% of the time.
And with that shorter length of stay, what are some of the potential risks?
Well, some of the potential risks, balancing patient satisfaction, readmission rates, and overall quality is challenging when managing lower length of stay requirements. The key to this balance is through increasing efficiency and effectiveness. And this comes with streamlining processes so that staff can focus on the best patient outcomes in a short time frame. Patient preparation before and throughout their inpatient stay, albeit short, is vital to ensure that they are ready to be discharged and reduce the likelihood of readmission.
So you may only have 1 or 2 days of direct care with that patient. What are progressive orthopedic programs doing to maximize recovery during a shorter period of time?
Well, Jason, better outcomes start before surgery. Patients need to be well prepared for their joint replacement. This preparedness comes in the way of good medical management of comorbidities, consistent messaging from the surgeon's office to discharge, strengthening prior to surgery, and setting expectations through standardized, thorough patient education prior to and after their surgery.
All right, so with all of that, what should hospitals be coordinating with patients ahead of their surgery to influence an optimal outcome?
Patients should ensure that their medical comorbidities are well managed, and that is 1 to 2 months before surgery. For example, HbA1c level, anemia, any sleep apnea, or high blood pressure. Managing these will optimize their outcome. Many hospitals also promote prehabilitation to position the patient for functional success. Exercise or prehab strengthening 2 to 3 months, if possible, before surgery. In addition, patients need to prepare their homes, and that is remove loose carpeting, install handrails, pre-cook meals, have family friends stay with them, and manage their pets. They also need to educate themselves as well as their coach. It is our experience through hospitals that we have worked with that patients receive a set of expectations prior to their admission. These are utilized by the nurse and rehabilitation staff to communicate progress and discharge readiness.
All right, we've talked about the potential impact of length of stay on patient care and preparation. Let's shift gears a little bit and talk about data utilization. There is plenty of patient data being collected by hospitals, third parties, as well as CMS. How are programs using that information?
Well, and that's right. There's a considerable amount of data out there. And what our hospital partners are using in monitoring metrics is through our proprietary business intelligence tool, Orthoval, which allows metrics to be readily available and to be tracked through multidisciplinary teams. Markers such as length of stay, clinical outcomes, or complications and infection rates, and functional outcomes, such as patient-reported outcomes. This allows the team to focus on root causes of outliers and manage them accordingly through a team approach.
And I know you've worked with hospitals that have had positive outcomes within a shorter period of time or length of stay. What have you seen?
Well, what we have seen is a reduction in length of stay, an 86% increase in the number of discharges on day 2 through consistent messaging, standardization of patient education materials, and then a trend in increases to home and home health. We continue to ensure that this does not negatively affect readmission rates. We have also been working on root causes for clinical complications through focused chart audits.
Well, that's a large list of excellent results and impressive improvements. So what else is on the horizon?
Well, I believe we will see an increase in demand for outpatient joint programs for one. Also an increase in participation of accountable care organizations. And I would think more benefit to participate in bundle payment initiatives.
Yeah, I agree. Patients are going from being in the hospital for 1 or 2 days, in the current and not so distant future, patients will be going home the same day, so hospitals have to be ready for that. That concludes today's discussion on the current length of stay trends for total joint replacement patients. If you have any additional questions regarding this topic or any other topic, please reach out to your local Zimmer sales team member, and they can facilitate a discussion with Dawn or any other member of the Accelero team. You can also reach us on our website at www.accelerohealth.com and go to the Contact Us section. Thank you for your interest in Accelero Health Partners.